Good afternoon, everyone, and welcome to our ongoing series with Heat on Facebook. Today, I'm going to be talking to you about hepatitis C, or HCV, as one of our STIs to be concerned about or be aware of in your healthcare. What we'd like you to know to start with is that hepatitis C is a viral infection that leads to the inflammation and damage of the liver and can lead to liver cancer, and in some cases, if left untreated, could be fatal. We know that there are a number of people, rated on our current stats and data, that indicate that a number of people are living with both HIV and hepatitis C co-infection. The challenges that are related to these two infections simultaneously is that it makes one of them very difficult to treat, so we have to prioritize one above the other. What we do know is that 1 in 5 people who are currently living with HIV in Canada may also be positive for hepatitis C. And that if you are positive for both, that it may result in a negative or a false hepatitis C test result should you have one done. So there are some challenges with treating hepatitis C and HIV as a co-infection. Most ARVs, or antiretroviral therapies, are run through the liver. The process runs them through the liver, and as we know, hepatitis C already attacks the liver and causes damage, so it actually makes the liver work twice as hard. HIV can actually accelerate the progression of HCV, or hepatitis C, and we generally treat hepatitis C first before we treat HIV for those two reasons, mostly because of the liver issue and mostly because it's easier to address one before the other. It's also important to know that we actually have a cure, an effective cure for hepatitis C, which is the first time we've ever been able to cure any viral infection. So, what we also want you to know, there are 3 stages related to hepatitis C, and those include acute, chronic, and compensated or decompensated liver or cirrhosis of the liver, which is the final and most life-threatening stage of hepatitis C infection. There are currently 1,600 cases of hep C indicated and reported in Alberta as of 2016. The rate of carriers has not changed over the last 4 to 6 years, with 60% of those still remaining in the ages between 50 and 64 and being men. Transmission of hepatitis C occurs through blood-to-blood transmission. Injection drug use still remains the #1 cause for hepatitis C transmission, so using safe equipment and injection drug use tools is very, very important in reducing this transmission. Transmission can also occur sexually, although very rare, but it also requires that blood be present in that sexual activity, and it's usually involved with rougher type sex. So it is rare, but it can happen. You can also be positive for hepatitis C if you had blood transfusion or blood products prior to 1990 when we did our big blood overhaul, or if you've had dental work or some kind of other surgery outside of our country. So just be aware of those. Body art, shaving razors, toothbrushes, and other tattooing equipment can also transmit hepatitis C. So these are all areas to be concerned with and be aware of. Don't freak out about them, but be mindful. If you have any other questions on that, don't hesitate to call us. Testing for hepatitis C is 2 types of blood tests. One is an antibody test that checks to see if you've ever been exposed to hepatitis C, as you may have cleared it yourself prior. And then there's an RNA test that determines whether or not you have active hepatitis C in your system right now. So those are the 2 tests that we're using. There's a window period with hepatitis C, similar to that of HIV, but it's only 6 to 9 weeks at this point in time. There are additional tests that may come with that, so genotyping and some liver function or fibroscans may be done to indicate what kind of or if any damage has been done to the liver up to that point of your infections. Symptoms can take 20 to 30 years to ever show up, if they show up at all. And however, 15 to 30% of these symptoms will show up in the acute phase or in that initial phase of infection. Some of those symptoms include nausea, poor appetite, fatigue, bone and body aches, blisters or bumps or itchy skin, headaches and brain fog, and inability to concentrate and keep things straight. Swelling of the leg, 15 to 30% of these will show in the acute phase of initial infection. Treatment for hepatitis C includes direct-acting antivirals. 95 to 100% cure rate exists. So we are able to cure you or create a sustained virologic response is the technical term that we use. But you need to remember that even if you've been cured or had hepatitis C cleared of your system, you can be reinfected with hepatitis C again, so you need to engage in behaviors that reduce that risk of transmission occurring again. Getting tested is the only way you will know if you are positive for hepatitis C. So please make a chance or an appointment to go see your doctor, get tested for hepatitis C, get a hold of us if you have any other questions, and that is going to be our presentation for today, Friday's outreach presentation live with HEAT on Facebook. Thank you very much for joining me today. Be sure to come in for testing Friday night at Goliath between 4 and 7 p.m. Know before you go.